Mewing questions. So these are questions taken from the chat underneath my YouTube videos on the Mewing by Mike Mew YouTube channel. So we have got one from Adam X9I1B. So Adam, doctor, I do mewing, but eventually the jaw gets tired and gets down. Is there a point? I don't know. Well, I think you're pushing. I think you're doing hard mewing. So remember, we've got the hard or soft option, and I'm recommending the soft option. I know people do the hard option, and I've seen some of the best results from the hard option, but I've also seen some of the biggest problems from the hard option. If you're getting tired, then you must be pushing with your tongue. Now, the whole thing about mewing is it's supposed to be suction. You know, you get a suction hold, you swallow, you swallow, you swallow. You do a good mew push swallow, and you do it repetitively, dragging your tongue tip back so that the saliva pools down here. You then do a tongue sweep, engage on the end spot, pop the saliva back, do it again. So your pump action, the tongue's pumping back. Each time you're draining your salivary glands, you're making a bigger and bigger suction. Now, how hard is it to maintain a suction? It's effortless. It doesn't require any effort at all. So clearly, Adam, whatever you're doing is requiring effort. That's why you're getting tired. That's hard mewing. Now, knock yourself out if you want a hard mew. But do that at your own risk. I don't know the long-term consequences of hard mewing because it's uncharted territory. But even if you are hard mewing, whatever else you're doing, the rest of the time that you're not eating, speaking, or processing with your mouth, you should have a suction hold, you should have a max vax, you should be completely clamped together. So whether or not you do anything else, you're still mewing, and you should still have a vacuum in your mouth, and a vacuum takes zero effort to maintain. Please, people, this is the important point. It should be effortless. And you know, when I get a suction hold, watch my posture now. It actually makes, get a good suction hold, it makes better posture more comfortable. That's the whole point. That's how we should be. You know, if you're not mewing what you're doing, there's such deep importance to that phrase. All right, the next question from Roberto La Scala. Got an actual name I think I can read. Okay, he says, how do I pull my face up and forward? I do chin tucks every day, been mewing for about a year or two now. Is there something I'm missing? Well, remember, chin tucks are only to gain range, all right? You should be holding your head back into a balanced position. I mean, I go into this really well in the Mewing app. You should only be holding your head back into a neutral position, a balanced position with the suction and the back third of your tongue. You mustn't hold it back using these neck muscles. You'll upset the whole balance of the neck and cause yourself problems. All right. Now he says he's been mewing for a year or two and is not seen his face come up and forward. Well, you know what? It's pretty hard to achieve that. And 90% of people I meet, they're not mewing much of the time. Particularly if you're thinking the chin tucks are really going to do it for you, because that sounds like someone who's trying to do a function, not someone who's trying to change their posture. Because posture's how you are, function's something you do. And if you're going to do some chin tucks, yeah, and then do a bit of mewing, and you think, you know, it's like you're doing press-ups, and you do press-ups and you can get good muscular build-up. There's no question about that. But if you want to get bony changes, you need to engage posture, which is all of the time. Remember, the difference between function and posture. Function's what you do in a moment. Posture's how you are all the time. So, Roberto, are you like that all of the time? Okay? Because so many people tell me they're mewing all the classic is someone says, oh, yeah, I mew all the time. And I go, you sure you're mewing all the time? They go, yeah, no, I don't, I'm not seeing results. And I go, but you're hanging your mouth open. And they go, oh yeah, well when I'm not doing that, I'm mewing. Well, all right. So when you're thinking about it, you've got a good position. Well, you're probably only thinking about it, 5% of the day and none of the night. So what change are you going to get there? I mean, come on, be logical. You need a lot of practice and just time. It's not complex. It's just time dependent. Okay, so we've got some Vanch F2Q71. Right, Vanch. Why I'm getting saliva again and again after suction hold, and my tongue gets slipped, and I don't know when it did. How do I fix this? Okay, so what you do, you get your lips together, teeth together, tongue on the roof of the mouth. Once you've identified the back third, you've done some clicks to get your tongue into the right position. You've really understood the theory of gaining a good suction hold. Right, when you've got a good suction hold, you then swallow again and again and again, and you drain your saliva. So there is no more saliva. So if you're doing that properly and you've really drained your saliva, how can you have saliva again and again? Because you've drained it out. You need to do this for a while. Remember, this is time dependent, guys. It's time dependent. You've got to do a lot of sucking, swallowing, until your salivary glands run thick and dry. Because you think you can get no more saliva out at all. And then you've got that suction. And your tongue is then molded to the shape of your mouth. And once it's got in there and there's no space in your mouth, it tends to stay there. And now you've got a lot of neural memory going. As you're doing this, there should be, in young children, and I don't know about older people, you should get a endorphin release from the tongue working properly, the tip of the tongue on the end spot. And I think that also when you're properly working the cranial bones, because I think that we talk about thumb pulling, that is hijacking the movement of the cranial bones. And the cranial bones are, when I'm mewing properly and I'm really stimulating and I'm moving the cranial bones, and that's the next phase of mewing. When I'm doing that really very effectively, I find it's nice. It's a bit difficult to describe, but I wouldn't say it's a high because it's a little bit lower than a high. But it's got a nice, it's a little bit like meditation's nice, that type of thing. So, Vanj, I don't think you're mewing properly, mate. I don't think you've really got this. I don't think you've looked at the app where you've really got a suction. You've got to vacuum out your mouth till it's vacuumed. You've got to, as I often say, you've got to vacuum pack your lips back against your teeth. And why are teeth straight? Why are teeth straight in all these other wild mammals and all our ancestors? They did something. Well, they were vacuum packing the tongue and the teeth, the lips and the tongue either side, sucked in with the teeth in between. Teeth in between like that, and these suck back. And that's how you get or maintain straight teeth. Right, so we've got one from DV Gaines, 2440. I'll call you DV Gaines, I'm guessing. Does mewing, or meowing actually you say, still work while wearing Invisalign retainers every night? Right. Okay, so clearly you've had orthodontic treatment. You are wearing these aligners every night. Well, crumbs. If you're wearing aligners every night, that means you're holding your teeth out of where they want to go. Now, I've got a whole philosophy on that. I'm worried about. I don't know the answers, but you can hold the teeth out the balance zone. You can hold the teeth, in a position that's been artificially created by your orthodontist. And if that looks really great, then that's, and you want to keep that, then that's your decision. can't be my decision to say stop wearing your retainers. I'm not going to go there because I would be responsible for whatever I say. So you then go and put this, you've got nothing in your mouth all day long, then you put this aligner in at night. Well, I worry that messes things up. I mean, in theory, you could mew still with these aligners in, but you're going to get a real different tactile response. The teeth are going to bite together very differently. I worry it's going to upset things. If I were to use Invisalign retainers now, I would aim only to use a retainer in either the top or bottom jaw, and I would grind them so much that you could bring your teeth in near contact, pretty much, so that the teeth are actually biting together through multiple holes in the Invisalign retainer. And then you're going to get the tactile response of the tooth-to-tooth tactile response. You're not quite, even the thinnest retainer is going to take up a certain amount of space, and the tongue feels, it's incredibly sensitive organ. So look at the homunculus, look up the homunculus, and you notice it's this image with a guy with great big thumbs and hands and a great big tongue, and this is representative of the neural sensation, right? And it demonstrates how important the tongue is for sensation, and that's important because the tongue's doing a very incredible dance around your mouth, and I think it's probably doing quite a lot of other things that if you were in an environment where a lot of your food wasn't as good quality, I think it would help with the processing and alerting you to problems. Anyway, I'm not a big fan of Invisalign retainers at night. If you're going to use within the normal retainer regime, I would probably use a bonded retainer behind the lower front teeth. And nothing's perfect, nothing's ideal. The best way is not to have a retainer, but clearly, as I've mentioned, I can't recommend that. I like a Frankel appliance. A Frankel appliance is a really good retainer because it doesn't actually hold the teeth out. It tips the balance in favor of your tongue, and your tongue holds the teeth out. It's not magic. It's not going to suddenly get you great gains. There isn't magic. The magic is remembering to do something all the time. That's the magic. It's that neural change that you remember to do something all the time, and then that's the same as anything. If anyone wants to become good at something, they just need to remember to apply themselves and to apply themselves consistently. That's the magic. Yeah. Sorry to be the bearer of bad news. I know it's dull and I know it's boring. Okay, next question. Ponkies 5501. Okay, Ponkies. It says, Dr. Mike, how do I keep my tongue glued to the top of the palate, no matter how much I swallow? Only the first and second part of the tongue glue on, and the third stay on bottom. Please help if you can. Thanks. Well, have you properly identified the back third of the tongue? You start by doing a cheesy swallow, then you start by doing a normal swallow, then do the cheesy swallow, clearly identifying where the tongue is, doing like to get it into a good position. Then you've got to identify the back third of your tongue, and you do that with the cheesy swallow. And once you've identified the back third of your tongue, then I can't see how you're not getting the back third up onto the roof of the mouth, unless you're short of space. And I don't want to sound like a reoccurring record, but lots of you are going to be short of space. I'm sorry, I didn't make the rule book. I have just made observations and worked some things out. And lots of you are going to be short of tongue space. And so, a good way to check if you're short of tongue space, identify the back third, get a good suction hold with the back third, which Ponkies clearly is struggling with, and then chin tuck. Yeah? Don't hold the chin tuck with the neck muscles. Remember, you're going to hold it with the back third of your tongue. And if you then can't breathe, you lack tongue space. There are ways around it with persistence, or you might need some artificial assistance, but be careful with artificial assistance. Now, Ponkies, have you really worked and built up the strength of the back third? Because that's my first question. Lots of people come to me and then, they haven't really built the strength up. Because once you've built the strength up and you glue the tongue fully on the roof of the mouth, then you don't really get so many problems. It will stay there. I can't talk for everyone, but it should do. So just try that, repetition. All right, so now we have Foxtrot 451 little x, big X. Do you have content or advice for people who struggle or can't breathe while holding a proper suction hold? Well, I think you need to go to Ron Eads' Jaw Hacks. Ron Eads, he's doing brilliant work. He's doing, the alternative orthodontic, holistic orthodontic surgical junction. Okay, because that's he's had surgery. He's in the States where some of the best. I would love to say we had it going on in Britain, but we're behind the times here because the way the system is, I'm afraid. But he's in the States. They've got some of the best people over there, and he's gone around meeting people. And people are doing a lot of really interesting things. But Foxtrot, I spy you need help. You can, by working on your breathing, get really good breathing techniques. If you sort of compromise on the chin tuck, and then work in with the chin tuck. So see if you can get a suction hold here, and slowly bring it back as you get change. And the tongue kind of molds a bit better. It's amazingly versatile organ. It's not easy. None of this is easy. And you're all early adopters. You're all here way back. You know what I'm saying is considered heresy amongst the professional opinion. So we're not making headway. That's my advance. I want to get forward. And I have a feeling, Foxtrot, you might need some artificial assistance to get a little bit more space. However, you'd be crazy not to go and get my app and try that and see if you can get it. I'm not a salesman, but man, before surgery, pick up the low-lying fruit, mate. Okay, see what you can do. Okay, so next question is, it's a mash of letters here. F, S, D, S, G, F, D, S, F, A, S, D, S, whatever, yeah. Anyway, why I cannot breathe once I fully push back of my tongue on the palate. If I don't do it, I feel like I'm not doing it properly. Well, yeah, you aren't doing it properly. And you, like a sizable chunk of the population, are going to struggle to mew properly. Now, with extreme work and effort, you will be able to learn. No, if you're in the middle ground, if you're in the grey zone, okay, it is possible to get through that. Okay, working on breathing techniques like Vitego breathing, working on just constantly molding that tongue there, and not chin tucking too much, and then slowly chin tucking a little bit more. Okay, and eventually you can. People in the grey zone can get out of that. But people who are properly in the black zone, you're going to need some help, yeah? Whether that be expansion, we've discussed tissue-borne or bone-borne expansion, and I think I did that in the last mewing problem video, or mewing tips. It's hard, I'm sorry guys. I wish I had all the answers, and I'm working on it. We're getting there. And I want to work out what the best assistance, whether that be surgery or non-surgery, to help people like you. Okay, next from James Matthews, Y9I. Is the suction hold meant to be fatiguing? No, and no. The suction hold is not to be fatiguing at all. It's a suction hold. You're sucking it up there. it takes zero effort to maintain a vacuum. If I vacuum out, here's got this bottle. If I vacuum out this bottle, I put my finger properly on the top there. That requires absolutely no effort at all. None. Then take the finger off and it expands again. But the finger, by default of suction, the finger's being sucked into that space. So it's effortless. And it's got to be effortless. I mean, come on, wake up. If, no one is going to maintain a position of effort in normal everyday posture in the long term. Okay? By definition, it's got to be comfortable because people maintain comfortable positions. So a suction hold should not be fatiguing at all. It sounds like you are pushing, that sounds like a bit like hard mewing you're going towards. And, I don't advocate hard mewing. I know people do it and I've seen some good results, but I've also seen problems. So just be careful. But suction should be absolutely no fatigue. Now, if you want to do some hard mewing, go on, knock yourself out, but do that at your own risk, and I'm not recommending it. Yeah. But when you're not hard mewing, or you're not speaking, or you're not chewing, or doing something else with your mouth, you should have a suction hold. Standard, absolute standard. Do not pass go, do not collect £200. That's where you should be. That should be normal spot. Stand up straight, shut your mouth. Okay. This is just a biohack to maintain that position by putting some suction, which you can maintain effortlessly. All right, so we've got a question here. It's called C. Babotac. Well, I'm going to call you Tack for the answer with this. It says, what can I do if I already have braces? Might mew. You're going to struggle to mew with braces. I mean, you can, it depends what braces you've got, but I would presume you mean fixed braces. Now, you're going to struggle. To be honest, you should be able to mew. I mean, I've had people mewing with braces before, but it just makes an extra level of complexity. And what you may find is as you start to mew effectively, you may get more irritation on the skin over the braces. Because I presume these braces are on the outside of the teeth, because if you're trying to mew with the tongue on the inside, you could potentially get a lot of problems. But if you're if you've got the braces on the outside, you're going to suck everything in towards the teeth as you make a suction hold, and that's likely to increase irritation between the braces and the skin. All right, but otherwise you should be able to mew just fine. Well, it's more difficult, but you should be able to do it. Okay, then we've got F Matrix 7. All right, he says, I've got TMD issues while mewing. How can I resolve this? Severe pain in my jaw joint. Right, go and see a professional. Stop doing whatever you do. If you're mewing right, it shouldn't really create jaw joint problems, but I would suspect you're also chewing. That's what so many of the mewing people are doing, and that's going to precipitate jaw joint problems. I think you almost certainly had jaw joint problems. If you go back to our ancestors, you just didn't see any pathology on the bone. I mean, clearly they don't have the soft tissue within the jaw joint, so it's difficult to tell if they had diagnosed proper jaw joint problems. But the seeming total lack of pathology on the bone would suggest our ancestors had very little jaw joint problems. And since they were actually wearing their teeth down, you can be pretty certain they did a hell of a lot of chewing, and we suspect that they were mewing naturally. So they were mewing all the time and chewing a hell of a lot, and it would appear they never got jaw joint problems. So I think jaw joint problems come when there's a gap, there's a different position. So you rest in one position and you spend 95% of your time in your resting position, usually with your tongue between your teeth, maybe your lips slightly separated, but definitely the tongue between the teeth. So the teeth are slightly separated. Well, then the jaw will reform into that position. Then when you bring your teeth together, the jaw joint's over closing. And then worse, you start to clench in that position, And you're clenching because you know the tongue's not on the roof of the mouth. It's not working as a natural antagonist against your jaw closing muscles. And of course, you then just go off because, you know, once you've lost the antagonistic response, there's nothing to stop hyperactivity. And you bring your teeth together, off you go in a phase of hyperactivity. The jaw joint is crushed, and you then bash and bash and bash it in a crushed position, and you're going to get jaw joint problems. Whether or not mewing caused it, I mean, it's more likely to be you're suddenly chewing, okay? And you probably had that as a latent problem already, but go and see a professional. Yeah, stop chewing. Stop the chewing. Yeah, it was the one caveat. There's a general rule. We say people who are upswung have less problems, and the more downswung you get, the more problems you get. And there's a large range of problems. I mean, the breathing and sleeping, and a lot of the problems get worse and worse and worse as you downswing. Jaw joints are the exception. Okay, so jaw joints tend to be with people who've got good muscles. Okay, and they tend to be the people who drop down a little bit. Then they put their tongue backwards between the back teeth. Then they end up with getting a deep bite. Remember, they've only got a deep bite when they bite together. They don't actually bite together all the time. They rest with their teeth. Normal, what we call overjet and overbite, but with the back teeth, the tongue between the back teeth, so the back teeth separated. So then, and that's where the jaw joint forms. And then as they bite together, of course, the front teeth hit. And it's worse when it's like this, and then they slide, and then the jaw joint goes, not only does it close back up into the gap, but it goes backwards and up into that gap. Oh, crumbs. That's really common in India, I notice when I go there. And I know I've got a lot of mewers from India. Class 2, Division 2, and it's class, you often see the front two teeth are tipped backwards, and the side teeth are twisted round. And that's an absolute, you know, that's an alarm bell for people getting jaw joint problems. And just be careful. That's the one big caveat for mewing, is going into jaw joint problems. Not that I think mewing causes it, I think bad mewing causes it. All right, so we've got someone called Joy Kuma. He says, after 1 year of mewing, only my left side improved. What should I do now? Okay, I bet you, bet, most of the change you've achieved is through chewing, not mewing, okay? Okay, so what we've got three supports here. You've got the teeth on, we'll call this the left side, you've got teeth on the right side, and you've got the tongue in the middle, okay? So, ideally the tongue gets a change. You get that real inner U. You get the real inner U change when you get the tongue doing it. And then you get the real outer U change when you get the teeth doing it. Now the problem is, if most people, and this is again and again and again and again, well, they can do the chewing, but the mewing, well, that's boring and it's dull and it requires constant engagement, which it's boring and dull. I know it's boring and dull. So they don't do that nearly as much. And actually the mainstay of what they're gaining is change through chewing. Now, right, so if I take this central support out and it's not being very effective, then we've got the supports on the other side. We've got the chewing on one side, chewing on the other side. Well, most people chew asymmetrically. So if you've got asymmetry, then that's from chewing. If you were mewing and you've got your tongue right up on the roof of the mouth, that will correct asymmetry. That reduces asymmetry. So if you're getting asymmetry, it's because you're overusing one of the muscle groups, left or right. Well, it would be left side, but let's get your left side improved. Right, so Joy Kuma, get your tongue up there and stop chewing. Okay, all right, well, last one in this set we're going to do here. Dr. Mike, how do someone with a high arched but average palate mew suction based? What do I think that actually means? Okay, this is a tricky one. How do someone with a high arch but average palate? Well, let's just say, well, how do you get a suction hold if you've got a... I mean, these are almost contradictory terms, because people with high arches don't have an average palate. That's by definition. You even a wide, very flat palate. You know, I had a guy come in to see me who was actually brought up in the Amazon jungle, and his palate was almost flat, literally flat. Okay, And when you look at ancestral skulls, the one with the big, wide dental arches, their palates were almost flat. And they, and so with an average palate, well, that would be an average modern palate, which would be reasonable arch, you know, probably 0.5 centimetre or a bit more. And then high arch, well, you're going up to about 1 centimetre, maybe a little bit more. Well, what are you? High arch or average? All right. If you've got a high arch palate, you will get problems getting a suction hold because you've got this big V that runs through the back. And you've got problems because you don't have enough space for your tongue. And if you've got a high arch, it's almost certain the whole maxilla's drop back and down. So if you're thinking about the tongue starts here, well, as soon as the maxilla drops down and back, you're coming closer and closer to where the tongue is supported. And that's going to cause you problems. All right? So, it's, by the way, that's from Crying Man 102. So Crying Man, I think, you just need to get a good suction hold. I've just been through a lot of this. I would review through what I've been saying because so much of that is going to apply to you. Remember this well, people out there. Mewing is not that complex. What's complex? There is some complexity to it, fine, okay. But it's trying to maintain it all the time, okay? And it seems to me from this conversation, it's repetitive exercise, practice, and then getting a good suction hold. So you hold it with a suction, all right? And there are going to be some of you who are going to struggle to do it because you lack space, all right? Anyway, guys, listen, thank you very much. I hope that all helps. The Great Mewing event. It's going to be the 6th of September in central London. This is an opportunity to meet me, to meet several other speakers that I have selected that understand this field, this concept. And they're coming in from different angles. And there is nothing like meeting us in person, asking questions, and getting a real better idea on what's going on, how you can help yourself improve. Listen, 6th of September, see you there.